Thank you to these sponsors of the Before I Die New Mexico Virtual Festival in 2020. A Good Goodbye, Gail Rubin puts the fun in funeral planning. After, a new way to stay connected with your loved ones in the cemetery anytime and anywhere. Aquamationinfo.com, where you can learn about alkaline hydrolysis, an eco-friendly alternative to flame cremation. Compassion and Choices, offering care and choice at the end of life. Daniel's Family Funerals and Cremations and Gabaldon Mortuary in Albuquerque. Fairview Memorial Park and Vista Verde Memorial Park in Albuquerque and Rio Rancho. Avista Cremation and Burial in Santa Fe. DeVargas Funeral Home and Crematory in Espanola and in Taos. Estate Pros, which offers personal dispersal of possessions due to a move, illness, or death. French Funerals and Cremations and Sunset Memorial Park in Albuquerque. And Keeper, which helps you keep memories alive with online tributes to preserve, celebrate, and share life legacies.
Death is full of surprises, huh?
You have no idea.
Yes, welcome. I am Gail Rubin, the doyen of death and the coordinator of the Before I Die New Mexico Festival, virtually being held this year because of the coronavirus pandemic. But you know what? It's actually working out really well. We are able to bring experts and interesting people from all across the country. And today, for this session, I'm actually very honored to welcome Jan Wilson, who is right here in Albuquerque, New Mexico, from her own home. But Jan and I were able to be on the road last year, and she presented a great presentation, which she will bring to you today, about planning ahead for advanced medical directives. You know, in this day and age of medicine can save your life and it can keep you from dying, but you may not want to be in that position, hooked up to machines and whatnot. And what Jan will present to you this morning is a great overview of what you need to know before you wind up in the hospital to make sure that your wishes are honored. So Jan, good morning. You're ready to rock and roll?
I sure am. Thank you very much, Gail. And I really appreciate the fact that you're going to help me with our chat and comments, as well as having me again. I'm trying to decide whether this is more fun than traveling up to Taos and Espanola or not, but we'll see how it works out. Um, while I've been at home, I've been watching a lot of webinars. You wouldn't believe all the information that's out there on death, dying, not dying, all kinds of things. And so I've been able to watch one on the completed life, how advanced healthcare planning is a little bit different than the directive. And I just wish that we could all have a time today to talk about all these new ideas that I've gotten and have a really robust discussion. Alas, that's not going to happen, but I'm going to try to show my entire presentation. And if you have comments or questions, if you could write them in the chat, and thank you again to Gail, who's going to help monitor those. And we'll have enough time at the end to ask all your questions, or perhaps you have some comments on how your advanced directive has worked so far. We're going to do this presentation, and you see Compassion and Choices at the top. I am a volunteer with Compassion and Choices. And what is Compassion and Choices? It's an organization, and what we do is provide information about how to be more comfortable with death, how to plan for it. And we also have an arm of the organization that advocates for legislation and for the choices that we hope that everybody will be able to make. And why do I put a plug in for Compassionate Choices? Well, when I'm actually on the road or going to a presentation, I have all the materials, and they are very great about sending me enough materials so I can do my presentations. They also have a wonderful website and has a lot of information. But what does people really want out of life and their end of life experience? Well, most people want to die at home, surrounded by loved ones. Most people would also choose an improved quality of life over just quantity of life. But what's the reality these days? 1 in 3 people tend to die in the intensive care unit or in the hospital. And about 1 in 3 people near the end of their life receive some non-beneficial treatments. Unfortunately, we're still at the point where a lot of doctors feel they are failing if they can't cure you. And so they keep trying. And that's not really a judgment, it's just a fact of life right now. So how do we want to die? Well, first of all, if we know how we want to die, we get to plan ahead a little bit. So again, at home with loved ones, with pain and discomfort managed. For me, that's a big one. Having your spiritual values respected. And there might be other considerations that you all have that about how you want to die, because this is a very personal topic. So a question I usually ask is, okay, who already has an advanced healthcare directive? And I'm glad to say in the last 5 years, I've been able to see a real increase in the number of people that raise their hands. So my next question is, who of you have looked at it in the last couple of years? Sad to say, a lot of people pat themselves on the back once they've written one, and then they forget to look at it again. And things may not change, or things may change, and you may not want the same things. But if you haven't raised your hand, don't worry, you're not alone. So why do people not have an advance directive? There's a lot of reasons, but these are the ones that I come up against most of the time. Oh my gosh, I don't have time to complete one of those. Well, I'm not sure we all have that excuse anymore. I don't want to talk about death. I'm too young. Well, I've heard people at 80, 85 still saying that. And we know that it's not going to necessarily be a long life for everybody. So we need to talk about it. If I talk about it, I'm going to be done in. Well, my good friend Gail, as she always says, talking about sex does not make you pregnant. Talking about death or funerals does not make you die. God will take care of me. I can't argue with that. A lot of people do believe this. My personal belief is that sometimes God needs some help, though, and your planning can make things a lot easier on the people around you, even if you're trusting your God. Oh my gosh, it's way too complicated to fill out. I couldn't possibly do it. Well, I'm hoping that by the end of this session, you're going to say, oh, that doesn't sound so bad. I can do that. I will warn you, though, it does take some thinking. So if that's complicated for you, yeah, maybe it is too complicated to fill out. And my favorite, my spouse, my son, my daughter, my best friend, they already know what to do. So I don't have to fill one of these out. Really? Have you talked to them about that? And I will give you an experience from my own life. My mother had done an advance directive, or living will as they were called then. And she picked me as her proxy because she knew I would pull the plug. And that's her words, not mine. And she said, I don't want to be a vegetable. I don't want extraordinary measures done. And I blithely said, of course not, Mom. I'll do what I can for you. Well, then I started doing these presentations and I realized, what did she mean by vegetable? What does she mean by heroic measures? And so I sat down and had another talk with her. And guess what? We were in the same book, but not necessarily on the same page. So don't assume that your family members know what you want. So these are some of the reasons I've heard for not having an advance directive. So why do we want to have an advance directive? Well, for one thing, it helps with planning on many levels. In order to do a good one, you have to clarify what your values are, what your priorities are. And so just thinking about all of these things helps. It does have some legal authority. If somebody comes into the ICU or the emergency room with your advance directive and you can't speak, it will resolve some of the questions that the doctor might have. It also might increase support of choices within your family and your medical community. Usually, or so I've heard from my presentations, this brings peace of mind for not only you as the individual, you as the patient, but you're also your family members. They don't have to try to figure out what you're thinking and what you would want. It's all written down there. And of course, you've already talked to them. Now, I don't know about your family, but my family doesn't always see eye to eye. And sometimes that having an advance directive will help to minimize the disagreements between the family members. And we're going to talk more about how do you choose your proxy. And it can prepare for the future. You might be able to include options in there that are not legal, not accepted yet, but if they become acceptable, this is what you want. Also, it helps with dementia, because now they are allowing people to write down what they want at certain levels of dementia. And this is hopefully not right now for you, but it will be in the future, unfortunately. So we're going to follow some steps. First one, this is a thinking piece. How we want to live. What are the values that you live by? What's important to you? What brings meaning? What brings joy to your life? You might want to stop and just think of a couple of things right now. And then the other question, have they changed over the years? I know mine have. When I was 50 and working, I had a very different set of my priorities than I do now as a retired person. And I'd like to think they're a little bit better. But they have changed, and there's a good chance they'll change even more as I age. Now, if any of you have downloaded the book from Compassionate Choices, there's one called My End of Life Decisions. And it has a toolkit with a lot of these kinds of charts. And I would recommend that you download it or send for this booklet and go through this values worksheet. Now, it's not the only one around. You can find others online. But what it does is it helps you to think of a lot of different things that you might not otherwise. You know, what's very important or what is not important at all? Letting nature take its course, is that what you want? Being independent, is that very important? Where do you want to be at the end of your life? What facility? Where do you want to stay home if possible? They have this chart here, as well as some open-ended questions. And this is for you, or you can just take it out of the booklet once you've written some things down and add it to your advance directive. And that way, people will get more of an understanding of who you are and what you want. Now, in the latest webinar I watched, it talked more about advanced care planning rather than the actual document. And part of this planning is actually telling your healthcare agent or your healthcare proxy what types of treatment you might like and how far to go. It's changed my mind slightly that it's really hard to tell sometimes right now what you're going to want when you're sick. However, let's go down a couple of these things and let me explain what I mean by them. One, do you want to be resuscitated if somebody should come upon you and you aren't breathing? Do you want CPR? Well, that depends a lot on your age and your health. For example, when you're 50 and you're robust and your bones are doing great, you may want to have CPR because you want to live a little bit longer. If you're 80 or 85 and your bones are very porous and you know that you're going to have real problems with the CPR, it can puncture lungs, it can break ribs, and you may not even end up living very much longer. Do you want to go through that pain? See what I mean about how your life values change? Ventilation. Well, right now with COVID, we know that a lot of people, go on a ventilator. But you need to decide, again, if you're 85, is it worth it? If being on a ventilator for a couple days after an operation will get you back home, then maybe you want it. So what do you put in your advance directive? This is the tough part. Well, in that booklet that I talked about decisions, there's a whole page on your preferences. And you can check off for a lot of these and other treatments. Yes, do it all the time, no matter what, if you can. No, don't ever put me on ventilation. Or there's a third column and it says, let's do a trial. Let's see if being on the ventilator for a few days helps me. And then you can also write down, I leave it up to my doctor's discretion as to whether I will get better using this treatment. So yes, talk about the kinds of treatments you might want or not want, but also leave some wiggle room, if you will, in case things change over time. Some other considerations that you can add to it is maybe the timing of hospice. Do you want to be in hospice right from that time you get the diagnosis or wait until later? Do you want to be at home or in a facility? And again, this may depend on your situation at the time. And that's real important to remember. Your situation at the time should be what you want in general, but more specifically. So we're not going to go all the way through all of these other considerations, but just know that you can add an addendum to your advance directive and list some of these considerations and what you would want. Who should have an advanced healthcare directive? Well, anybody over 18, because we never know when we're going to be in an accident or come down with a disease of some kind. So it's good to have those. Obviously, 18-year-olds think differently than 70-year-olds at times. So just be aware that you're going to have to keep on reviewing it as you grow older. What you want as you're going away to college and being fairly carefree may be different by the time you're 30 and have a great job and have a family. Or when you get to be 70 and you're retired and your family is grown and you don't have to have some of these other considerations. Mainly, don't wait until you're old or sick. Too often people wait to make some of these decisions, and then they can't really express themselves adequately to really tell people what they want. And again, you're going to hear this a lot from me. Things may change as you grow older and you're in a different time of your life, and that's okay. Now, another who is probably the most important who. And this person is called your healthcare agent, healthcare proxy, power of attorney for healthcare. There's all kinds of names that you can use. But it's the person that's going to make some decisions for you and speak for you when you can no longer speak for yourself. Now, if you've downloaded any of the forms, you'll notice that the proxy is the first thing you fill out on the form. And that's good because that's going to be the first thing that people look at. However, when you're going through the process, you need to think of your values, think of what kinds of treatments you want, so that you pick the right person to be this proxy. Okay, what do they need as far as criteria? Well, they must be 18 years of age for it to be valid. Mentally competent. I realize this can be a little subjective, but I think we all know what we mean by mentally competent. This is a very, very important one. They must agree to take the responsibility of helping you through the medical process, helping you having decisions made for you based on what you want. So that person must be willing and able to follow your wishes and advocate for you when necessary. And this has got to be so important a decision for you to make. One thing I hear a lot is, well, I've got 5 kids. How do I choose which one to be proxy? Well, first of all, having 5 of anybody making decisions for you could be very difficult. So you want 1 or 2 people to be your proxy. And it may not be the oldest. I did a presentation with Maria Otero, and she said in her family and in her culture, usually it was the oldest daughter. Now, is the oldest daughter really the right person? Does she have the wherewithal to make difficult decisions? I don't have either my brother or sister on mine because I don't see them as often as I do my good friends. My husband, on the other hand, has his brother, but he did not want his older sister because she falls apart if somebody comes in with a little scratch on their finger. What is she going to do if somebody is actually dying? So think of yourself for once. I know a lot of you think of other people and what they would like, but think of yourself and who would be the best person to make those decisions and who will follow what you want. And again, this may change over time. And just another brief story. When I started joining Compassion and Choices and going to some of these different presentations, I realized I was patting myself on the back because I had done my Advance Directive. But wait, that was back in 1998, and I had not looked at it since then. And so I got it out, and guess what? The people that I had as my proxy, I barely speak to. They're back in Massachusetts. I send Christmas cards. They are not the person that I would want at this point in my life to be my proxy because we just don't know each other. Some things to add to this list that are possibly important, but something to think about at least, is if you have a medical person that you feel would fulfill this duty, that's really good because they would understand what the doctor is saying. Or if one of your proxies could be somebody who has gone through the medical system in some way, either for themselves or for a loved one. Because it can get very confusing. And so having somebody there who understands it is much better than having a daughter, let's say, that hasn't really had much sickness in her life. So those are a couple of others. Somebody said, well, do they have to live nearby? No, they don't have to. But boy, if you have somebody who can go into the hospital with you, that's even better because person-to-person advocacy is sometimes better than doing it by internet or phone or that kind of thing, although that can be done even more so these days. So now that you've thought about your values, maybe what kinds of treatments you want, who your proxy is going to be. You've asked that proxy, and they said, sure, I could do this for you. Now, how do we document our wishes? Well, first of all, we choose an appropriate form. There's one that you can get through Compassion and Choices, tailored for New Mexico, or any other state that maybe you live in more than you live in New Mexico. There's one called 5 Wishes. Presbyterian has its own. I believe UNM has its own. You can just go on the internet and find one that has the right questions. Now, if you've downloaded the one from New Mexico from Compassion and Choices, or that Gail sent out, you'll notice there isn't a lot of room to write things. So I always suggest that you write an addendum, because you can write on your advance directive, see addendum number 2 for more explanation of how I feel about this or that. Okay, you've got the form in hand. Now you need to complete it. And once you complete all the choices that you want to make, you sign it. There's a space for witnesses. Now, New Mexico doesn't require witnesses. In fact, now that I'm mentioning this, New Mexico doesn't even require a real form. You can just write a letter with all your wishes. But getting back to the witnesses, we always recommend that, because there's no question then that you were not coerced into making any of the statements you made in the directed form. Now, some people like to have it notarized. If you're going to go to your bank, perhaps, I know our credit union still notarizes things. Just don't have your witnesses sign before you go to the notary. The one good thing about having it notarized, even though it's not necessary, is that some states do require notaries. And if you have kind of the highest level of directive done, then you will be good to go in all of the states. Now, mind you, I have not heard of any state not honoring people's wishes when they come with an out-of-state form. So don't worry about that part. Then what do you do with it? Well, one thing you don't do is put it into a safety deposit box, because it probably won't be looked at until after you're gone. Put it in a very obvious place, maybe the top drawer of your desk. Personally, I have mine on my refrigerator. I don't have any grandchildren's pictures, so my health directive will have to do. You also need to give one to your proxy or proxies, to your doctor. And I'm going to interject here. If you're a Medicare patient, or age, I should say, you can get an appointment with your doctor for discussing your end-of-life wishes. All you have to do when you call for an appointment is to make sure that they recognize that that's why you're coming in, and it will be coded a certain way and paid for by your insurance. So your doctor now has one. I recommend giving one to your family members, so there's no question of what you want, even if they're not your healthcare agent. I've also put one in my glove compartment, which came in really handy when my husband had a heart episode while we were in Arizona a few years ago. Turns out he needed a quintuple bypass. But I was able to follow him into the hospital behind the ambulance, and we had our health directives in the glove compartment, and I was just able to hand it to the clerk and go right in. First time I've ever really taken my own advice, and it was worth it, that's for sure. You can also get small business card size cards and write on it who your proxy is and where your advance directive could be found. And then keep that in your wallet or in your pocket as you travel. So Now we've done the distribution. What if you make some changes? Well, all you have to do is write in your changes, date it, and then initial it. And the latest date will count. If you make lots of changes, I would recommend rewriting the whole thing. Now you've distributed it to, half a dozen people, or it may be in 2 cars in the glove compartment. I also recommend writing down who and where all your directives are. So when you make changes, you can make sure all these people and all these ones that are hidden somewhere have been changed as well. Makes sense, right? Not too hard. Does take a little time. Now we have a lot of resources. I mentioned a few of them in, I believe, the email that had the link here. But this book, I think, is invaluable. It's a little booklet, I should say. It's My End of Life Decisions Guidebook and Toolkit. And it has a lot of these different forms that you might want to use. You can get it through Compassion and Choices. There are also lots of other great resources out there. 2 things that Compassion and Choices have added recently is dementia tools and the COVID-19 addendums. I'm not sure exactly when this poll was, but they figure 1 in 3 Americans will be diagnosed with dementia. Obviously, we can cure a lot of other diseases, but dementia is much harder. And so they've developed a tool to go through all the different scenarios that you might come up with, the different levels of dementia. In that booklet, they do have a page where you can write down all your preferences. But I would recommend going through this tool online because it will say, okay, you're very forgetful at this point. What kind of treatments do you want done? Well, you may still be pretty healthy. You may want to continue getting treatments. But should you get to the point of not being able to feed yourself, not being able to do any of the daily activities, not to be able to even recognize your family or be able to speak with them, do you still want to have all of these treatments done? Or if you get to that point, do you want to cut off at some point? They also have this handy little dementia decoder. And I think this is great because it's sometimes stressful going to your doctor's appointment. And you see that it has 3 different sections. 1 on general illness, 1 if you have cancer, 1 if you have dementia. And it gives you a whole list of different questions to ask your doctor. I do try to think about everything I can before I go to the doctor and write them down. But a lot of people don't. And going to your doctor's office can kind of make you forget what you wanted to ask. And then all of a sudden you go home and say, oh no, I forgot to ask this or that. So this was a very helpful tool, I think. Now they've also just come up with another addendum that you can use for COVID-19. And it's only if you are diagnosed with COVID. And this is very appropriate for what the treatments are so far. If your oxygen levels are dropping, do you want to go to the hospital or do you want to stay at home? Can you get some treatments right at home, such as maybe an oxygen tank that would keep you comfortable? And if your disease does not progress, you could stay at home. Do you not want to be at home? You don't want to maybe infect other people around you. Or perhaps you need a ventilator or some more extreme intervention. Well, this also says, how long do you want to be on that ventilator? 2 or 3 days until the doctor says it's okay to go off? Because if you've read any of the articles, sometimes being on a ventilator can cause scarring of your lung tissue. Some people even never get off a ventilator. So you need to think about this. And I'm not trying to give you the answers. I'm just trying to give you the things to think about and what fits in with your values and where you are in life. Here's some more resources. The bright green one is called the New Mexico MOST, or Medical Orders for Scope of Treatment. Now, why is this different if you have an advance directive? Well, it's because a doctor does it with you and signs it, and it really becomes medical orders. So it has a little bit more authority with it. But as you can see, it does not say as much. Basically, it's for EMTs who come to your house or wherever you may be when a crisis hits, and it's to tell them whether or not you want to go to the hospital. Do you want CPR? Do you just want comfort? On the back of it is a place to put your proxy and where to find your advance directive. Most of the time, people only fill these out when they have a chronic condition or they've become quite frail, and nobody would be surprised to find them on the floor of their bedroom, let's say. I know my mother, when she was in an assisted living facility, they asked all residents to fill one of these out just in case. Ours here in New Mexico is this bright green. If you've come from another state, it might be bright pink, bright yellow, but something that will stand out. Again, if you have one of these filled in, you would want to keep it with your advance directive because your advance directive says so much more. Also, you want to make sure your doctor has one, or your cardiologist, or perhaps the facility where you live, make sure they have it in your file. And just as a by the by, if it's done on white paper, it's still just as valid. It just might not be noticed on your refrigerator or wherever you might hang it. I believe our resource list was also included in the email. And this list is something that the Albuquerque Action Team, of which I'm a part, put together with different sites that we've thought were helpful. They also listed a lot of different books that are great and some odds and ends of other resources for you to use. The Compassion and Choices materials are really good, and a lot of them come in Spanish now too. So now we've done all the hard work. What's up now? Well, for one thing, we have I consider this a living document. It needs to be reviewed regularly. Maybe not every few months, but at least every year or two, or perhaps after you've gotten a diagnosis from your doctor. Have the conversation and have it again and have it one more time because things are going to change. This is a very personal but very hard subject to bring up, both with your proxy, with your family, even with your medical provider at times. So you need to have the conversation often in order for that to kind of sink in and for you to actually verbalize what you want. I've even, in some of the webinars I've watched, they have been recommending doing a video of all your wishes. That makes a very powerful tool to have a video on your phone or in a flash drive or something like that that can be watched. Do you want more information? Do you want a presentation for your group? Your group being from your family, book club? I've even done one for 150 people at a Rotary meeting. I would love to be able to present more information and have more discussion with you or a group. This is my information, nm_jan@q.com. And you're welcome to email me with any questions. You can use my cell phone. It's probably better at this point at 505-264-8020. And since I live in Albuquerque, I would be happy to pull together a lot of these materials and bring them to you at some meeting place, if that is the best way to get this information to you.
If we're ever allowed to meet in person again.
Oh, well, I'll put it on the curbside. I've done that. Left things outside of people's houses, that's for sure.
I did get a question. Would
Okay.
you make your slides available?
Yes, I would.
Okay.
I would send them to people. From
So-
my theory in this is the more people that can hear about this and read about it, the better off everybody will be. And even though it does have compassion and choices, little decorations on it, they're basically my slides, so that's not a problem at all. I do have a few more minutes that I wanted to spend on a slightly related topic, because you may want to include some of it in your Advance directive. And
Okay.
that's,
So,
and
so if you want to get the slides, email Jan.
yes, I'm sorry. You'll have to email me.
Yeah.
Unless there's some other way, like Gail, that you can,
Well, I'll put your email in the chat.
okay, that'd be good.
Okay.
Or if people want to talk to me first and, and then I can send them to them, that would work too.
Okay.
Now, I know there's going to be a really neat panel discussion tomorrow at 1:00 about the medical aid in dying bill. But there are a lot of other options that I would like for end of life that I would like to just mention in a few minutes that we have left before questions and comments. One is you can pursue life-sustaining treatment as long as you want, as long as you're talking it over with your doctor. And a lot of times, as I mentioned before, the doctor often keeps on giving you different treatment options. So it's up to you to decide, when do you want to discontinue? Or do you want to refuse some medical treatment right from the beginning? And I know people have asked, well, what happens if they find you on the sidewalk, they put you in the ambulance and take you to ER, and they start some of these treatments? Well, if they're really things that you do not want and are in your directive, they will probably try to get hold of your proxy. And as soon as they do, you can have your treatments stopped. Or if you can still speak, you can make your wishes known. I think a lot of us sit back and wait for the doctors to make these decisions. But I want you to know that it's in your hands as well. Hospice. More and more people are using hospice at an earlier stage in their terminal illness, which I think is great because hospice has a whole variety of services. And you can combine hospice with what they call palliative care, comfort care. You don't need to have one or the other. And in fact, as long as you do not have active treatment for what they consider your terminal diagnosis, let's say cancer, you can be treated. So it's not that you will not ever be seen by a doctor again. And what this means is that, let's say you fall out of bed and break your hip. You can be treated for that broken hip and then go back to hospice care. And as I said, hospice provides a variety of services, and it's well worth looking into. One thing I would say, though, is you may want to do it even now before you're sick. Look into some of the hospices and find out what their philosophies are and what they will honor as far as your wishes, because there are differences among them. Voluntary stopping eating and drinking is another way that if you've decided that you just cannot bear this life anymore, you know it's ahead for you because of your diagnosis and your prognosis, you can voluntarily stop to eating and drinking. But this can be a tough one. It really takes a lot of self-control and commitment because it will take a few days up to several weeks, depending on what your disease is, what it's affected, and what your physical condition is. But it's something that for people with, let's say, ALS, Lou Gehrig's disease, something that you don't get terminal diagnosis for a long time, and yet you feel that you've lived your life, you've completed your life, and you just don't want to get to the point where you no longer can do anything for yourself. This is an option. Palliative sedation usually happens when you are uncontrolled pain. Luckily, this doesn't happen, I don't think, as much as it used to, because there's better and better medications that people can give. People start with hospice earlier. Usually the patient is unconscious or basically unconscious, maybe in and out of consciousness, but basically unable to communicate. But the doctor and the nurses can tell that they're in considerable pain. And so you keep on giving more and more pain medication, which in effect ends up stopping the organs from working. And within a few days, again, depending on where you are at with your disease and the functioning of your organs, you peacefully basically go to sleep. Medical aid in dying is a very conscious choice. And this is what the definition basically is. It's for terminally ill, mentally capable adults with a prognosis of 6 months or less to live, although there is talk about changing that to foreseeable future or some wording like that. But it is the option to request from your doctor a prescription for medication that you have to self-ingest, but it will bring about a peaceful death. There's a lot of medical aid in dying support. I don't know if you can see this all that well, but it's again around all demographics, political versus age versus ethnicity. And the total back in 2017 was 73% people believe this should be a choice. Even if you don't ever plan to use this choice, that people should have this choice. And what does the data show? And I'm going to go through this pretty quickly because the panel discussion will be discussing a lot of this in more detail. But back in a couple years ago when this was done, only 1/4% of all the deaths in Oregon have been through medical aid in dying. And Oregon is the oldest, has the oldest bill on record. Over 30% of the time, these drugs aren't even used if they're prescribed, and the patients end up dying on their own. But having that medication means the world to them. This is a map of our United States. The blue are places where they already have it legalized. The yellow have legislation pending, or they're working on getting legislation to the legislatures in the next year. And the ones with stars have groups like the Albuquerque Action Team, the Silver City Action Team, Las Cruces Action Team, and other groups working on getting the bill passed. Now, what's the eligibility requirement? You have to be 18 years or older. You have a terminal illness, whatever that might mean. Most of the states right now say 6 months or less. Need to be mentally capable of making your own healthcare decisions. You do this while you are still competent. And if a doctor feels that you need some referral to a psychiatric or a social worker or something like that, he or she will do that. And you have to be able to take the medication yourself. Some other requirements, again, I won't go through all of these, and they vary a little bit from state to state. Oregon just passed an amendment to theirs saying that there's an only 48-hour wait period instead of 15 days. They found that too many people going through the process was so long that they ended up dying in pain and misery and everything else before they actually got all the way through and got the prescription. Now, some people will say, oh, this is suicide. And it can be argued on both sides, I guess, except that we have this chart which shows the difference between medical aid in dying for somebody who has already got a medical terminal disease and somebody who has decided that for whatever reason they do not want to live. And that brings the third point there is usually the person who uses medical aid in dying, if they had their druthers, they would want to live. They still had a lot to live for. Whereas in a suicide, the person wants to die because they feel their life has no meaning. The biggest thing is that death is gentle and peaceful, usually within a couple of hours to maybe a couple of days. It really kind of depends. But usually with suicide, the death is very violent and very impulsive, usually done alone in secret. Aid in dying, you have normal grieving because the whole family was involved in all of this. And medical aid in dying actually has shown to improve care in states that have the law, which is kind of seems counterintuitive, but just having the prescription is a comfort. And often people with terminal illnesses will go into hospice, and hospice has improved their care. So it's a whole cycle. So I'm now ready for some questions. I want to thank you for supporting end-of-life options if you do. And again, my information, in case you missed it the first time around, although I think Gail said she put it in the chat. And I welcome hearing from any of you.
Bruno actually typed in a comment. Despite the myth, poor people and people of color are not coerced into aid in dying, I guess. And in fact, it can be hard for them to access it and other end-of-life care options. Bruno's in Seattle, and a group in Seattle called A Sacred Passing is addressing this. So that's good to know.
Mm. Yeah, and we actually at Compassion and Choices have several very active groups, both of African American and Hispanic, because to address the fact that sometimes medical care is unequal, and we've heard more and more about that with the COVID-19 pandemic. And we don't blame people for not trusting their doctors and trusting some of these things. Mm-hmm. But if done carefully, I think people of all ethnicities, all ages can benefit from it.
We have a comment or a question. Are advance directives considered legally binding for the hospital?
That's a hard one to answer because there's always the question of, does the doctor do what he thinks is or she thinks is best for the patient versus what the patient wants? And this is why having a proxy as your advocate helps. Supposedly, at least in New Mexico, the hospitals are supposed to honor it unless they say that they are not going to. If you run into some religious hospitals, they need to say, as far as I know, they need to say right up front that they will not do or support the patient with either aid in dying or VSED, voluntary stopping eating and drinking, or some of those things. Mm-hmm. Does it happen? Sure. And if you have an advance directive, but it's not on you when you get to the hospital, there's a good chance that you might get things that you don't want if you can't speak for yourself.
There was,
It's not a black and white question, unfortunately.
yeah. Also a follow-up, if you want to have two healthcare proxies, is one primary and one secondary?
Depends on how you write it. You can write in your advanced directives, I'd like both of them to be consulted. Or, person 1A is the primary, but if person A is not available or for some reason, then go to person B. So you can do it either way. And you may want to talk to your proxies even together, now that we have Zoom, and make sure they're both good with whatever you've decided, or if they would like to be in consultation with the other one, just to kind of level out the level of authority or responsibility.
Mhm. I know when my father-in-law went into the hospital, he had his wife, my mother-in-law, was his primary advocate, healthcare proxy, and my husband was the secondary. But given the choice of we can admit him on palliative care and let nature take its course, and he had said no heroic measures for his treatment, that would, she wanted him to get well and come home, and she didn't want to make that decision. And it did fall to my husband and his wife, the doyen of death, to say palliative care is a really good choice. And that is ultimately what we did. But you need to have that paperwork in place to provide that kind of guidance, or else, the surviving family members or loved ones could be saddled with a lot of guilt.
Absolutely, absolutely. And a lot of disagreement.
Yeah.
I've seen a documentary where, let's say, the daughter wants one thing and the son, and either one of them may not have been around all that much and really know their parent anymore, but they choose to, they were fighting over the hospital bed, and you don't want that either. And my husband is my primary proxy, but we've talked about this. Obviously, he's heard my talk a few times. And so I feel very comfortable. I know some people that I would not feel comfortable if they were going to be my proxy, because even though they say they believe what you want is okay, and push comes to shove, they're going to buckle under. And so that's why it's so important.
We have another question. Do you have a suggestion for the best form that provides for different options to choose from for different circumstances?
Well, to tell you the truth, I'm in the middle of redoing mine, and I'm using the compassion and choices form, the form that you can get download from there. I don't like it, especially because they don't have room right on it to write everything I want. So I'm going to take my own advice again and write an addendum and say, under, do I want CPR or not? See addendum, and I'll explain in what kind of circumstances I want it. And that if it's a totally different circumstance, please ask my proxy what's appropriate. Because we know medicine is changing so fast these days. You can write something now, and all of a sudden the treatments for, let's say, cancer are very, very different, or it's not as life-threatening to have some of those operations that, a few years ago, you would say, no way, I do not want that.
I don't remember hearing you say anything about the 5 wishes form.
I went through it really quickly.
Oh, okay.
That one's a little more, I'll say, religious oriented. And actually, I have used it and crossed out a lot of things that I did not want. I do not need hymns in the background as I'm dying, for example. But some people might.
Yeah.
And it does do a lot more, I'll say, the touchy-feely stuff in it. Just be careful to read it carefully and cross off anything that really doesn't pertain to your values.
I like the area where about how you want to be treated toward the end of life. And I wish to be massaged with warm oils as often as possible. Don't wait until you're dying to get a good massage.
Absolutely, absolutely.
I am looking forward to tomorrow's conversation about medical aid in dying, and would like to also put in a plug for the session that will be before that. We have Barbara Mancini, who wrote a book called Heartless Death, Cruel Aftermath, about her 93-year-old father who was on hospice, wasn't getting enough morphine to kill his pain. And out of frustration, he grabbed a bottle of morphine out of her hand, drank it, and she said, "Wow, that was a lot of morphine you just consumed." But she didn't like raise any red flags. But when the hospice nurse came, she mentions this. Well, the hospice nurse calls and has her arrested for assisting a suicide and puts her dad in the hospital, which is exactly what he didn't want. They had the paperwork. It all went to hell in a handbasket. And I mean, this is a very powerful lesson in you can do all the planning and still wind up with something that you don't want. But she'll be on Sunday's sessions right before our medical aid in dying conversation.
I'm looking forward to both of those myself, because you can always pick up new things. And since you brought this up, all the planning in the world, depends on what situation you find yourself in sometimes. And since we got all these casinos, I usually throw in, you're playing the odds and you're increasing your odds by having this planning done and written down. So that's why I really push for this. Who knows whether it will work when the time comes, but I've got a better idea. My proxies have a better idea of what I want, and then I'll get it.
Althea put a comment in saying choosing more than one person as proxy is a recipe for disaster. Doctors want a consensus on end-of-life choices, and if those two people disagree, then the doctor will do whatever he or she wants, no matter what the Advance Care Directive says. What do you think about that?
Well, you keep on hearing about some of these horror stories. Again, it comes down to the person talking to each of their proxies and making sure that they agree with what you want, so that if they both agree with what you want, then hopefully they would agree with each other. And it really boils down to who you choose and how well you know them and how well they know you. And hopefully you won't be put in that situation where there's two choices that are maybe both appropriate in their own way.
Yeah.
But definitely don't have, I actually have 3 proxies, because my second and third one travel so much, I'm afraid they're not going to be around when I need them. So, but again, they all are on board with each other and have kind of ranked themselves as to who has the most authority if need be.
Althea added, there are many lawsuits against hospitals and doctors who are not following the Advance Care Directive.
Okay. That's great. Well, not that lawsuits are great, but it means that things are changing. And there's another Dr. Arup Mangalek who has spoken in many places. His big thing is that doctors have to be trained better to follow these things and to follow your orders. It helps when you're Medicare age, because you can make an appointment with your doctor and have it coded as an end of life discussion. Younger people trying to grab your doctor can be more difficult, that's for sure. And of course, when you go to the hospital, you don't even have your primary doctor half the time. So it's difficult. I'm not going to say it's 100% foolproof, I'm not going to say it's easy to do. It's just a good thing to do.
Any other information you want to pass along? Gail?
I'll add in one thing. When I wasn't sure how this was going to go and how much feedback we'd get, I did leave out when you document your wishes, besides the Advance Directive, they now have apps for your phone where you can put it in on an iPhone. And I don't have one, so I haven't played with this much. There's a little heart, and you can put in appropriate medical information, and one section would be your Advance Directives. Somebody suggested that you can put it up in the cloud, and you have a file. And this is where I bungle a lot because I'm not too real technologically savvy. But you can put a password on it, so only your proxies or your son or somebody like that can get into that particular file, and they won't see the rest of the files that you've put into this cloud or thing. And there is a kind of like a Fitbit that you can get where you can put that information in, and it does cost a little bit of money to get it and then register yourself, but the EMT can come in if you have it on your wrist, turn it over, get your serial number, call it in, and have all of your information right there too. To me, that sounds like something that would really work well in more rural situations where you're not just 5 minutes away from a hospital.
Well, and the technology, may or may not be there.
Yeah.
Speaking of, we have that jewelry that people would wear, medic alert jewelry. How effective is that?
That can be very effective. You do have to register with the New Mexico. Shoot, if somebody's really interested, I can get it for you. But it's not that, and your doctor has to sign something. It's not that you go out and get a little bracelet engraved, "Do not resuscitate." And it's for a do not resuscitate order for the most part. But you can do that. And because you've registered, it becomes more legal. Don't just put in a tattoo over your forehead or on your chest, because that does not count, just so you know.
Tattoos don't count.
Yeah. Phooey, I'm sorry, I don't remember that, and I didn't have it in my notes today. But you can get a bracelet or a necklace with that.
I know my mother-in-law is like allergic to eggs, so she's got that on her necklace or bracelet, I think. Patricia noted that Apple Watch has the Heart app as well, and that comes loaded on the watch for free. So,
right. Okay. Thank you. Well, I just want to thank everybody who did join us. I appreciate being able to spread the word, so to speak. It is becoming more and more a thing to do, and I appreciate it. And just so you know, if you do a living will with your attorney, it's the same thing. But just be careful that they include everything. I know my original quote living will was not as complete as my advance directive is. But if you work with your attorney, they can certainly write what you want in there.
And I trust Bob is totally recovered from his quintuple bypass.
Yeah, he's had a couple of stents put in since then, 5 years. But it was one of those situations that he seemed healthy, good weight, everything else, and you never know. And that's why I put my advance directive in my suitcase when I travel, in my glove compartment. Sure, I might not have it right on me when something happens, but I increase my chances.
Wonderful presentation. Thank you so much, Jan. Thank you
Thank you.
all to the attendees who have been participating online with us. And this is going to be a video made available online after the festival. So